If you're addicted to nicotine, then there's a good chance you've swapped your packet of cigarettes for vaping in the past few years. But while the dangers of smoking tobacco are well known, well researched and without question, that's not the case when it comes to e-liquids. The Scottish Government announced today it will consult on whether to ban advertising for e-cigarettes and vaping products. The advice from the NHS is that e-cigarettes are definitely less harmful than smoking tobacco, but it stresses they're not risk-free and more research is needed. There are now half as many vapers as smokers in the UK, with an estimated 3.6 million people opting for an artificial puff. E-cigs are now cited as the most popular quitting aid for smokers. However, the deaths of 11 people in America have provoked several states there to issue a ban. New York and Michigan have prohibited the sale of flavoured liquids. Massachusetts has banned all vaping products for 4 months to investigate what's been described as a public health emergency. Globally, China has halted online sales of e-cigarettes and India has issued a total ban. In Holyrood, the First Minister addressed concerns about the safety of vaping in Scotland.
To date, though, we've not seen any cases of deaths attributed to vaping being reported in Europe. Our approach has been a precautionary one, which is why in Scotland we have already taken the strictest regulatory approach in Europe to vapour products. The European Tobacco Products Directive restricts the advertising of e-cigarettes and ensures that e-liquids can't contain ingredients which are known to be harmful. The directive also limits the concentration of nicotine in e-liquids.
Scotland's medical establishment, including health charities, academics and NHS Scotland, endorse vaping as safer than smoking. They say based on the current evidence, vaping is less harmful than smoking tobacco and that it would be a good thing if smokers used them. Earlier we spoke to Professor Linda Bold from Edinburgh University, an expert in cancer prevention, and vascular surgeon Professor Sharif Sultan, who works in Ireland. Sharif, could you just explain first of all why it is you want to see a ban on vaping in Ireland?
That's very important to understand that harm-free versus reduced harm. Any degree of harm is wrong, and there's no degree of harm is acceptable. We have to understand that the latest generation of vaping devices use nicotine salts. And this nicotine salt, the amount of addictive substance in it is very high, and it gives a lot of addiction to the brain, and been used by a lot of kids that the brain is under development. We don't know what's the long-term effect of such a problem. The FDA have just announced a criminal investigation. The Juul CEO have just resigned, and they have banned the advertising on CNN, ABC, and NBC. Moreover, apart from any of that, the Walmart have removed all the devices from their shelves. So if we don't see what's going on, we have a problem. The Center for Disease Control have announced just 15 minutes ago, there is more than the 530 cases and more than the 11 cases that announced their deaths. One death is too many.
Okay.
And I don't like any of my patients to be stats in any paper.
Linda, do you understand Sharif's concerns and also the point he's making that it's too early to say what harmful effects there might be from vaping?
Well, in the United Kingdom, we have 7 million people who still smoke, and we have over 100,000 deaths from tobacco every year. And cigarettes can be bought on most street corners in many retail outlets. So while I absolutely recognise that these are still relatively new products, and I absolutely agree with Sharif, they're not safe, but it is about harm reduction. And we have over 3 million people who've switched to vaping in the UK. So to take those products off the market, having worked with smokers for many years, I know that what will happen is they will go back to smoking, and that will inevitably result in hundreds of thousands of deaths in the future.
Sharif, what's your response to that? If the people can't vape, they'll start smoking and there'll be many more deaths.
I don't agree with that. Nicotine is dangerous regardless whether they're going to take it e-vaping or through smoking. I'm totally against both of them. We know that the effect of nicotine increases blood pressure, causes the incidence of heart attack to increase, and it decreases the blood flow through the heart. The problem that I'm facing currently is that the chemical makeup of the vape is highly variable. And how can we recommend something that we don't know how it performs when it's overheated? The lung injury is a disaster. And you could see the amount of kids that's sick in the United States. They have this popcorn lung syndrome It's equivalent to other respiratory distress syndrome.
But Sharif,
and
the fact remains that there are substantially many more deaths from smoking than vaping.
That's at the 7th decade, Rona, and you have to wait long time to have this effect. I'm talking about a totally healthy guy who is 22 years of age, who goes to the gym, who could jog for 4 and 5 miles. Suddenly he's on a ventilator in the intensive care unit and waiting for a lung transplant. This is a disaster.
It's a disaster, Linda, for many people.
Well, I think it's really important in the UK and also in Ireland to understand the differences with the US. What we have in the US is a public health crisis. I agree with that, but it is not caused by retail purchased e-cigarettes of the type that are available in the UK and Ireland. These deaths, we've had about 11 so far. In terms of the investigation that has been done, these are illicit products in a market, the US, where they've singularly failed to regulate so far. Most of what we find in terms of the evidence that is causing these deaths, as Sharif says, in healthy young people, which is obviously very alarming, is the fact that most of these people, if not all of them, have been vaping cannabis oil. And cannabis oil isn't water soluble. They may have been using a thickening agent. We think it's vitamin E acetate. There may be other contaminants. And that's what's caused this serious and very rapid outbreak of illnesses. Keeping in mind, we've had these products for a decade, and there are 10 million people in the US who've been using them without these cases occurring before.
Sharif, that is the case, isn't it, that the deaths in America were linked to vaping cannabis, and that's unregulated? Does that not distort the picture?
No. In fact, Michigan, San Francisco, LA, New York have banned all flavored e-cigarettes. And the reason for that, they don't know whether there's a class effect or specific brands. And there's not one single brand have been identified by the FDA. We need a rigorous testing like any drug in order to have a good regulation. We cannot say it's safe. We don't know. The problem that we don't know. We are facing a problem. It's like the salamide in the 60s and 70s. 3 cases have been published as a case report, and everybody now know that salamide caused the problem. At that time, this was rubbished. Now we have 11 deaths and more than 530 confirmed sick people and more to come. So we have a warning. And we, as a responsible physician, must warn, educate the public that we know there's a problem happening, and you must know that it's not safe. It does some harm. The problem that we don't know who's the highest risk in the population that have this problem. And up to this moment, we know that a lot of people are taking it. It's safe, no problem, just go smoking. And you could see what the US General Surgeon have said. 37% of high school senior vaping in 2018, and it's jumped from 28% 2017. So there's 32% rise in 1 year. It's an epidemic that must stop.
Linda, is that a concern to you at all, that we will look back in maybe 10, 20 years' time and say, good grief, why did we not look at the warning signs?
So I think the key here is regulation. It's really important to understand the difference between the US and the European markets. So we have a notification system. We've banned certain constituents in the products like diacetyl, for example, that we know is harmful. We have a highly regulated market. It doesn't mean that there isn't an illicit trade here. Fortunately, we're not complicated by the issues of cannabis legalization that they have in the US. But regulation is really the only way to protect people. I think the problem is this is a knee-jerk reaction, effectively saying let's ban all the products, which is what a number of US states are doing. But as I say, they're not taking into account the fact that people will return to smoking. And also, just to emphasize, in terms of youth, these products are illegal for young people in Ireland and the UK. Fortunately, to date, our rates of use in young people are far lower. We are monitoring that very clearly. But just to emphasize, these deaths and this disease has not been caused by regulated products in Europe. It's an outbreak, as I say, of contamination. And I think it's important to strike the balance and not just say we must ban them everywhere, but to take into account the risks and the benefits.
We're going to have to leave it there, but thank you both for joining us this evening.
Thank you so much for the opportunity.